today that all of the territory's public school students in grades pre-K through 12 will return to school on January 10th virtually. Once again, all public school will return to school on January 10th, but everyone will be virtual. We understand that there is still a number of students eligible for the vaccines who are not yet vaccinated. So if you're a parent out there, or we want to keep your children safe, go out there and get vaccinated. For all those students who have already been vaccinated, you can as well get the booster if it's been more than 6 months. And we plan on resuming in-person learning for all our students on Monday, January 24th. All school-based personnel are to report to their respective school campuses as scheduled this Friday, January 7th. So we also want to make sure that everybody in the territory knows that we are trying to return to regular government hours on the 10th, that's Monday, and we'll make sure that if any other changes come about, we let you know.
There are currently 2,111 active cases in the territory. Of those, 998 active cases are on St. Croix, 1,017 on St. Thomas, and 92 on St. John. 8,090 cases have recovered, and unfortunately, there have been 89 fatalities. We are seeing a high number of active cases, but also seeing a high number of recoveries daily, thankfully. I want to talk to you today as a doctor. We have the largest number of cases within the territory that we have ever had. The Omicron variant is the most contagious COVID variant to date, which is contributing to our large case numbers. We are still seeing severe infection and the need for intensive care treatment, and unfortunately, a recent death. The most significantly impacted areas are our emergency departments, or the emergency rooms, in each hospital, including Mary Keaton Smith in St. John. The lines for testing are long, and everyone wants a test. Everyone wants to get tested. The Unified Response Team is working diligently to provide the support needed for testing and management for both in and out of the hospital setting, given our limited resources in the territory while being impacted by the national and global Omicron variant surge. Here is what you should do if you become ill or exposed. The most important defense is to become vaccinated or boosted against COVID-19. So that's what you should do before you even get exposed. Data reveals that 8% of breakthrough infections that we're seeing are among vaccinated people. So more than 90% of those that we're testing are among unvaccinated people. If you find out that you've been exposed to someone who is positive for COVID, do not run out to get a test right away. You may not develop symptoms or test positive without symptoms until 2 to 5 days later. If you are vaccinated, please continue to wear a mask and just monitor closely for symptoms. You do not need to be tested unless you develop symptoms. This is critical because our testing supplies will be exhausted unless we test the people we absolutely need to test and treat. If you develop symptoms of the virus, sore throat, headache, tiredness, fatigue, or cough, these are the symptoms that are unique to the Omicron variant, you should make an appointment to get tested. However, there are also the pop-up testing sites that are available. If you sign up prior to going to the pop-up sites, your time will be shortened. So visit covid19.usvi.care/testing and click on sign up here. This is important to document your infection and ensure isolation and quarantine processes are followed throughout the territory. You do not need to go to the emergency room just because you feel sick or to get tested. You should only report to the emergency room if you are having difficulty breathing or are extremely weak. If you do not have emergency symptoms, the emergency room is not the place for you. You will be discharged with the same treatment that you would have received at home. The emergency rooms are congested with COVID patients that can safely be recovering at home. If you do not feel short of breath, please contact the Department of Health or your provider for treatment recommendations and an appointment for testing. Do not flood the emergency room. It is important to know that contact tracing will not occur in all positive cases. If you test positive, The Department of Health epidemiology team will not contact you for tracing unless you are hospitalized or considered extremely high risk. To request a return to work letter, please submit a request to email results@doh.vi.gov. Again, email your request to results@doh.vi.gov. It's important to understand that while contact tracing is not going to occur, you still need to do the right thing and quarantine and isolate if you receive a positive test and are symptomatic. We are depending on you. We are seeing higher rates of COVID among pediatric ages, including newborns, infants, and toddlers less than 5 years of age. This is the population that is unable to be vaccinated and are being exposed by their parents most likely. The best protection for these babies is vaccinations among parents and family members. This is a request coming directly from pediatricians in our clinic. Dr. Thomas, I heard you this morning. The nation is seeing records of hospitalizations in the pediatric population, and so are we. Currently, we have an infant hospitalized at RLS for more than 1 week. We are praying for this baby's recovery. I'm encouraging the community to use best judgment right now. Limit your exposures, wear your mask properly, and gently remind others to do the same. Do not run out for testing unless you develop symptoms. Call for medical advice rather than flooding the emergency room, unless you truly need emergency attention. Your doctor may prescribe an antiviral if you contact them, and you don't need to go to the emergency department. Clean the environment and wash your hands. If you're positive, stay home, even if a contact tracer does not call you. We are relying on you to do the right thing to limit the spread. One more thing. Businesses are required to follow the quarantine recommendations by the Department of Health Epidemiology Division. If your employees test positive, they are mandated to quarantine and should not be told by you to report to work. The department is committed to ensuring mitigation and disease spread prevention. Investigations are ongoing and your business will be held accountable under the Public Health Declaration. To finish, here are the pop-up testing locations this week. On St. Croix, Monday through Friday between 1:30 and 3:30 p.m. at the Charles Harwood Building. St. Thomas, Monday through Friday, 1:30 to 3:30 p.m. at the SRMC drive-thru location. And on St. John, we have Tuesday, today, 12 to 3, and Wednesday and Friday, today, Wednesday and Friday, between 12 and 3 at the Viper Gravel Lot. Okay? So these are my 3 takeaway messages for today. Number 1, please be responsible and stay home if you're sick. Number 2, do not go to the emergency room unless you're critically ill. Don't go. And 3, prevent severe infections by getting your vaccination or going for your booster. Remember, 5 and up should get vaccinated. Let's get everybody vaccinated to safely return to school. Like the governor just mentioned, our schools will only be safe if we vaccinate all who can be vaccinated to prevent any additional setbacks and virtual learning.
And I'd just like to say a special thank you to all our healthcare providers. You know, Dr. Hunt is one of our generals on the forefront of this COVID battle that we've had for 2 years. I know when a lot of you called me over the weekend or texted me, emailed about the status of the Virgin Islands and the high cases, you know, we got to have a little trust in us. We've been doing this for a while now. We could shut down everything, but we felt that we could have a very controlled spread. The way that it's spreading and people being able to recover very quickly has been very promising. Only 8% of the people who actually tested positive are vaccinated, and most of those people have been vaccinated more than 6 months ago. And so we have control over what we're doing right now, even though the numbers count. In the hospital, I think today we have about 10 COVID patients total between the territory, and only I think 2 of those are in the ICU. So we do have some people who are having some difficulties, but for the most part, we've been through days when we had 29, 20, 30 people in the hospital, and we are not seeing that as yet. So as we look at that, we've also trying to ease the pressure in the emergency room. You know, this is an island. We only have so many doctors, so many nurses, respiratory therapists, lab people, etc. And a lot of them are getting sick, which is we always talk to people about and why the vaccine is so, another reason why the vaccine is so important, because once our systems start to crash, like police officers get it, corrections officers get it, doctors get it, nurses get it. Those people can't shut their offices. They have to go out there and fight this pandemic daily, face to face. They're meeting people they don't know. A lot of these people are sick, especially in our medical situation, whether public or private. So we're asking you, when you go to if you're having trouble breathing, then please go to the emergency room. Other than that, you're okay. You have a fever. You're going to use your Tylenol and your stuff to get better. Not from my mouth, from Dr. Hunt. She's an expert on these things. Has seen thousands of COVID patients over the course of this pandemic. For 2 years, we've been doing this, and like I said, our methods work. What we've been doing works. So we got another 2-3 weeks of writing on this and having these high numbers, and then I think we're going to be able to see some decline and a recession of this virus. But what we don't want to do is we don't want to slow the spread, so that we're doing this for the next 8 weeks by shutting down everything and letting it creep through our community. So it's at a rapid clip now, and God willing, we're going to be okay.
Governor, just one more question. As far as travelers, are we able to get our people back in to the territory that are trying to come home and not able to get negative test in time? How is that going, and what's going on with cruise ships?
Thank you, son. Good questions. Excellent. So as far as people getting home, we have been trying to work with people the best we can. I told people that we would be pretty easy about the test at 72 hours testing requirement for the first couple days. Tomorrow, Wednesday, we're going to get a little bit stricter about taking those tests. But we have been working with people, different situations, to allow them to get home safely by giving them the green chip. So if you're having a problem, you should call the hotline there on the Department of Tourism, and we should be able to help you get home. But you need a 72-hour test. I mean, we put this in place to discourage people from traveling, period, but we know people were away for the holidays, so we're doing our best to get them in. As far as the cruise ships, we have a memorandum of understanding with the cruise ships that causes them to report at 72, 48, and 24 hours in terms of their infection rate. If their infection rate rises above 1%, they're not allowed to disembark from the cruise ship. This is a memorandum of understanding that we have with all the cruise lines that visit our ports. It's the same memorandum. I'd just like to say that when we first started, the cruise ships were telling us that if we had a positivity rate above 3%, they wouldn't come in. Our positivity rate is now above 20%, and they still want to come in. And to the public, the cruise lines have been great partners for us from before COVID. We're in more danger to them than they are to us in terms of our positivity rate that we get now. And I'd also like to say a lot of the cruise ship infections have been the crew rather than the actual staff. Rather than the cruisers who have been creating the situation where they can't come in. They are, and I understand, having some further conversations about maybe amending those to 2%, which we are open to. It's not 2% is not a high rate or level of infection, but there's a considerable amount of investigations going on right now by the CDC into cruise ship operations. Someone was recommending, I understand, on the radio the other day that we set up a cruise ship hospital. What a management nightmare that would be for us to have to manage coronavirus in a cruise ship, as well as have our regular patients in that environment. I think they're doing an excellent job of managing their passengers, and I'm glad they're on the water again, but we'll continue to work with them to see what we could do to make sure we keep our people safe first and our guests as well.
Okay, great. And so can you give us an idea of how many ships you've had to turn away?
5?
Yeah, I don't think more than 5.
It was about 5 ships in total that we turned away, and then we because the positivity rate changes every 24 hours because you have people that recover on the ship. So, sometimes at 72 hours they can't come in, and then 48 they may be good, and then 24 hours they're bad again. So we've been working with the cruise lines and trying our best to make accommodations for they come in coming in. And, you know, people ask us why, you know, we have it like that. You have to remember that the people that are cruising are not registering on our portal. So we have a 72-hour testing requirement for people coming through the air, but we have an agreement with the cruise ships, and the reason why it's so harsh is because those people are not registered on the portal, and we're counting on our partnership with the cruise ships that they perform extensive testing to their crew as well as their guests. And they've been complying with that, so we're appreciative of that and hope to see them come back soon. Everybody just like hold strain. We got a couple more weeks to go through this, but we'll be here. You got people like Dr. Hunt, Encarnacion, Director Joshin, our whole medical and epidemiology team are working on this, and to all of my people out there on the front lines, our police officer, emergency room, 911, EMT, nurses, doctors, and all of the allied health people. From the bottom of my heart, thank you for everything we do. We do have a lot of help on the way. We've ordered extra nurses and everybody because we know you're getting tired. I told the commissioners and the hospital executive directors this morning, like when we get this help and we cools off, make you guys take mandatory vacations, take a couple of days off on administrative leave on us to make sure that you get the rest you needed, because I don't know how many more of these we have to go through, but we built for it. God bless, stay safe, stay sanitized, love you.
Great news! St. Thomas now has its own Galvaloon factory. VI Galvaloon Factory, located at Four Winds Plaza behind the dry cleaners. The only Galvaloon provider in St. Thomas with DP&R required 24-gauge material. Monday through Friday, 8 a.m. to 5 p.m. VI Galvaloon Factory.